years of internship and a year of community service. About 60 doctors are in limbo in Mpumalanga. Their community service ends this month, and they are bursary holders.
Because there has not been any communique to discuss with the doctors or to alert the doctors of the plans that they have of employing them post-community service training, which is an obligation from the side of a government to employ us, because we also have an obligation to serve back the years that they have funded us for. So that obligation must go both ways, because in the past we've had doctors who have qualified and have said, now, no, I want to move into the private sector, or I want to open my own practice, I want to relocate to KZN. And those doctors were made to pay back the funds that were still pending after the 3 years of service.
And this is likely to create a vacuum.
There is now at the moment a doctor for plus minus 1,000, and it's not below 1,000, it's above 8,000. Now let us imagine a scenario wherein government fails to employ 120 doctors in the province of Mpumalanga. The ratio now changes to 1 is probably to 2,000, which means that the work that was being done by one doctor, by 5 doctors, now has to be done by 1 doctor or 2 doctors.
The union says the poor and marginalized population relying on public health care will suffer. And with some hospitals already experiencing a shortage of doctors, patients are equally concerned.
I arrived here at about 6 o'clock in the morning. I was only able to see the doctor at about 9 o'clock. Since I arrived here at 6, the doctors arrive very late. In fact, there's a very much shortage of doctors.
The department is adamant that there are no shortages and that it has no obligation to absorb the doctors.
We're only obliged to employ doctors that are participating in the Cuba program. However, any other person, whether you're a bursary holder, yes, we do provide opportunities of them to come and serve in hospitals. But when it comes to the employment part, posts of doctors must be advertised, and they must apply, and if they qualify, and then they must be employed. There is no obligation that as the department we must absorb them even after they have served as ComServe or as bursary holders. That is the rules as per the DPSA, to ensure that we employ people that are qualified. We give every person an opportunity to apply.
The department also says it has no budget for new posts. Mpumalanga, SABC News, Mbombela.